Yeah, it's great. Okay. Everybody good? Everybody ready to go? Okay. Good morning, and thank you all for joining us. My name is Jose Garza, and it is my privilege to serve as your district attorney. I want to thank Ascension Seton Hospital for hosting this important press conference. We are excited to update our community on the collaborative efforts of our safety leaders and community partners to continue to implement a comprehensive county-wide gun violence reduction ecosystem. I'm honored to stand alongside county and city leaders, public safety officials, and community partners. Together, we work tirelessly to support victims of violent crime, to implement strategies to prevent violence, and to keep our community safe. I also want to thank many guests who are joining us today for their support, and for guests who couldn't be here, but without whom we could not accomplish this work. Representatives from the Travis County Health and Human Services Department, the City of Austin's Office of Violence Prevention, ATX Peace, the Harvest Trauma Recovery Center, Community Justice, Giffords, and the Health Alliance have all been critical to this work. I also have to take a moment because here in Travis County, we take seriously our responsibility to prevent gun violence. But I have to point out that while we gather today to celebrate our progress and our investments, in Washington, the Trump administration has cut funding that helps keep our community safe. But here in Travis County, we remain committed to our mission of ensuring safety, which is why we're excited to provide updates on some of these initiatives to you today. As many of you recall, in 2021, the Travis County District Attorney's Office outlined a 4-point plan detailing how we would address violent gun crimes. That included using both traditional and innovative prosecution strategies for sentencing people charged with gun crimes. It included working with community members to prevent gun violence by creating, supporting, and implementing intervention and prevention programs, and by taking guns out of the hands of those at high risk of committing an act of gun violence in an intimate partner relationship, and finally by supporting programming to help survivors and families of the victims of gun violence. We have seen significant success over the last 4 years and have more work to do. According to APD's crime statistics, because of the work of the Austin Police Department, because of the work of our law enforcement partners, and because of the work of the folks standing behind me, the City of Austin has experienced a 20% reduction in homicides since we began this work. In June 2022, Travis County and the City of Austin officials convened community members, policymakers, safety leaders, and violence prevention advocates at a summit on gun violence. We worked with community members to implement clear and comprehensive policies that prevent gun violence and make the community safer for everyone. During the summer and fall of 2022, our office and community leaders attended Commissioner's Court to share proven evidence-based solutions for reducing gun violence in Travis County. Our team collaborated under the leadership of Judge Andy Brown and Commissioner Jeff Trevelyan, along with partners from across the country, to propose the most effective public health approach to preventing violence here in Travis County. On November 1st, 2022, the Travis County Commissioner's Court approved the Safer Travis County Resolution, which included a hospital-based violence intervention program and a prosecutor-led gun violence prevention program. To share a little bit more about our county leaders, about what our county leaders approved and our county's role in supporting these programs, it is my privilege to introduce our Travis County Judge, Andy Brown.
Good morning. Thanks so much for joining us today to share some updates about this life-saving pilot program that we have here in Travis County. As the district attorney said, in November 2022, the Commissioner's Court approved the Safer Travis County resolution, and this allocated $500,000 towards gun violence prevention and intervention programs that we're doing right here. The Hospital-Based Violence Intervention Program, or HVIP as we call it, it stems from that resolution, and last fall the Commissioners Court brought the pilot to life through our partnership with Ascension Seton, which is where we are today. We designed the HVIP program to help build a gun violence prevention ecosystem, not only providing world-class medical care here in the hospital, but to take care that those that outside these four walls and connect survivors with community-based support services across Travis County. So the goal of this program is to prevent victims from engaging in retaliation. It makes sense. Data shows that people who are victims of interpersonal violence have a higher risk of being re-injured or committing a crime themselves. A similar initiative in California found that participants of the program were 70% less likely to be arrested again and 60% less likely to have future criminal involvement altogether. So it's too soon for us to have all the data here in Travis County from this program, but I'm really grateful for the work that Ascension Seton and everybody up here today is doing, especially the healthcare workers in this hospital. What we do know is that since its launch 4 months ago, the program has treated more than 300 victims of violence, with 15% of those cases being related to gun violence. Our partner and Ascension President Laura Fawn is going to speak a little bit more to that in just a moment. But through this coordinated approach, the program offers support during hospital stays and follow-up post-discharge. This unit provides referrals to community partners, including those specializing in mental health, substance abuse stabilization, shelter, food, financial resources, and legal advocacy, as well as employment assistance. So thank you so much, and I'd like to pass it on to my colleague, Jeff Trevelyan. Thanks.
I might have the easiest job in the world today, pointing out that we only get the community that we want when we build it together. And what you see up here is a coalition of people who live here, who love people here, and who try to provide the resources and build an ecosystem that is necessary for us all to be successful. You know, whether we're talking about mentoring, whether we're talking about tutoring, whether we're talking about someone who might have been in trouble, but we have others that have been in the same type of trouble and they commit to working together. Whether we're talking about working with the police department or with city council, what we have decided to do is work together. When we talk about child care, after-school programs, job training, the whole goal is to try to make sure that all of our youth have programs to look forward to, because what we know is our kids who are in programs are not our kids who are in trouble. And how do we build a foundation so that all of our kids know that if we work together, if we work hard, there's a place for all of us here. If we know what our challenges are, there's somebody who wants to address those challenges. At the end of the day, we have decided to build community together. And that's what we're celebrating today. All of the numbers aren't in, but we know what we hear when we talk to our youth, and we know what we see when they look in our eyes and tell us what's important to them. And this is important to our entire community. And we only get the community that we deserve when we build it together. And that is what this coalition is doing. And I think Seton's going to be...
Yeah, I'll take a second to introduce him.
All right.
Thank you so much, Commissioner. For the entirety of our journey to build this gun violence prevention ecosystem, Commissioner Trevelyan has insisted that we remain rooted in our community and rooted in the communities that we are serving. And I'm so grateful to you, Commissioner, for bringing that value to this work. Later this morning, our public safety leaders and community partners are going to be touring the hospital to see firsthand the incredible work that is done here every day to save lives, yes, but also to keep our community safe. This work is a critical part of our overall infrastructure, and there is so much more that we are assembling as a community to keep our community safe. This work also includes work that will be done at the District Attorney's Office as a result of the Safer Travis County resolution that was mentioned earlier. For the vast majority of people charged with the firearm offense, our office prosecutes their case in a traditional manner, collaborating with local law enforcement entities to ensure the successful investigation and prosecution of those serious offenses. We have been clear that if you pick up a gun here in Travis County, point it at another person and pull the trigger, you will be found, you will be arrested, and you will be held accountable. But we also recognize that the majority of firearm offenders sentenced to prison are one day going to be released, and the likelihood of recidivism remains high if we don't find another way to change their behavior. So to prevent recidivism from occurring, our office will be working with a community-based organization to pilot a prosecutor-led gun violence prevention program that will offer evidence-based interventions intended to reduce recidivism. Again, it is just one piece of our overall ecosystem, and while that program comes online, we are excited today to be able to celebrate the progress that we have already made at the hospital-based violence intervention program led by Ascension Seton. And it is my distinct honor to introduce you to the hospital's new president, Laura Fahn, who has a long history doing this work, not only in our community, but in this hospital. We're so grateful for her leadership.
Thank you very much. Good morning, everyone. Thank you all for being here. My name is Laura Fahn, and I have the honor of serving as the president for Del Seton as of Monday. So I've been with the organization for almost 18 years, and I've been here at Del Seton for 6. And this is such an amazing hospital with a mission to serve, and I am very honored to be up here with this group this morning. On behalf of Ascension Texas and our system president and CEO, Andy Davis, I am pleased to welcome you all to Del Seton Medical Center. We are the only level 1 trauma center in Central Texas, which means we provide the highest level of trauma care and care overall to Central Texas. Thank you all for being here today, and really just your continued partnership in our mission to serve our community. The epidemic of violence calls for a very creative community collaboration, and our hospital-based violence intervention program, or HVIB, is actively addressing violence as a public health issue. Through the HVIB, we are uniquely positioned to prevent future violence and the potential for readmissions of violence-related injuries. In 2024, here at Del Seton, out of our approximately 53,000 emergency room visits, acts of violence that are those injuries that are addressed by the program were among some of our top 3 causes for our trauma care and about 10% of our total injuries. At Del Seton, we are really thankful for the opportunity to partner on this pilot program that aligns with our mission to care for those that are most vulnerable and to continue to be an advocate for a compassionate and just society. As part of the pilot, we have a dedicated responder that is embedded in our emergency department, whose job is to work alongside our patients and victims and their families that have been impacted by violence. Our responder skillfully navigates the challenges patients face, specifically addressing the social determinants of health, such as social support networks, community safety, and economic disparities, while continuing to provide personalized support and case management. This includes also coordinating a seamless handoff to our dedicated partners in the community, many of whom are standing up here today, who are also actively working to prevent violence. In our first 6 months of the pilot, our team has responded to over 350 victims of violence, either here in our emergency department or in our acute care area, and within the first 48 hours of discharge from the hospital. This estimation includes patients that are here at Del Seton Medical Center and also our level 1 trauma pediatric hospital, Del Children's Medical Center, that is just down the street. Of these violence-related injuries, about 15% were related to gun violence. According to a recent study by the CDC, from 2020 to 2022, firearms killed more children and teens aged 1 to 17 than any other cause. According to last year's Surgeon General's report, 54% of all American adults say that they or a relative have experienced a firearm-related incident. At Ascension, Texas, and Del Seaton Medical Center and Del Children's Medical Center, we believe that relationships, teamwork, and collaboration are essential to providing comprehensive care for our patients. This commitment is evident as we stand here united with our community today to address violence together. I look forward to sharing more as we continue our journey and collaboration in addressing violence as a public health issue. Thank you all so much for being here. Thank you.
As Commissioner Trevelyan reminded us, first we should be rooted in the fact that Austin and Travis County are one of the safest communities in the state and one of the safest communities in the country. But that is not a future that is guaranteed for us. If we want to see that reality persist, we're going to have to continue to do the work. And as Commissioner Trevelyan reminded us, the way that work happens is by ensuring that system partners, systems like hospitals, prosecutors, law enforcement, are working hand in hand with community. That is what we have done and what we will continue to do. And this work would not be possible without our community partners at Life in You and ATX Peace. And it is my real pleasure to introduce Sherwin Patton, who has been invested in this work for the better part of 2 decades. Where are you? For the better part of 2 decades. Please join us.
Thank you. Thank you. Well, I want to start by saying that we're grateful to the hospital-based violence intervention program. We know that Seton Ascension's mission is centered at the heart of God. In fact, if you read their mission statement, in their mission statement, it mentions Jesus Christ as the answer to the problems in our community. And so I want to highlight that because when we think about relationships, we have to build relationships that are transformative. So us knowing the stats is important, yes. And us being able to address the issues through intervention is important, yes. But we also have to get down to the root causes of these issues. And I just want to read really quickly a verse that really makes sense in terms of what should be our true north. Isaiah 1:17 says this: learn to do good, seek justice, correct oppression, bring justice to the fatherless, plead the cause of the widow. And so when you look at this ecosystem that has come together, there are no big I's or little U's. It's all about us collectively looking out for what are the root causes of the issues that are driving violence in our community. And so that's the reason why you have the hospital-based violence intervention program that has been set up. That's the reason why ATX Peace, which is made up of 2 organizations right now, which is Jail to Jobs and Life Anew, working together collectively in order to make a positive impact by addressing mental health challenges that some of the families may have, by addressing some of the food needs that families may have, even some of the health equity needs and educational needs. We meet people where they are in the schools. But when those things don't work, then we have to collectively find out how we work together to intervene. And that's what the hospital-based violence intervention program is doing. They communicate well with those of us who make up ATX Peace in the community, and we work hand in hand to ensure the safety of every Austinite. And so communication is key. So as we address the culture, communication, and the climate of our city, it's going to take our collective effort. So I encourage us to, and I employ us, to dream together. Because if we don't dream together, then we'll die together. And that's not an option for us. Thank you all.
If there is a theme of these remarks that I hope you pick up, it is about the collaboration that has led this work from the beginning. We've talked a little bit about the county's contributions to this ecosystem. We've talked a little bit about the hospital's contributions, the community's contributions. We also have to take a moment to recognize the significant contributions over the last several years of the city of Austin to building this ecosystem. First and foremost, starting with our partners at the Austin Police Department, who put themselves in harm's way every day to keep our community safe and to prevent gun violence and to hold people accountable who commit acts of gun violence. And we also have to recognize the city's Office of Violence Prevention, which has been a critical component of the overall ecosystem. I have been so pleased just to get to know Councilmember Velasquez, who is an incredible champion for this work, not only because of his lived experiences, but because of his values and heart. And it's my pleasure to recognize and introduce Councilmember Velasquez.
Good morning, everyone. Thank y'all for having me here today. I want to start by echoing the sentiments of my colleagues, and I'm grateful for the actionable steps that we're taking together to address gun violence in our community. Some of you, a fair amount of you, know the pain of losing someone to gun violence. It's a pain that never fully goes away. For me, that pain became personal in 2009 when I lost my brother, Francisco Pancho Iruegas, to gun violence. He's one of the biggest reasons that I stand here today, not just as a council member, but as someone who understands the firsthand the impacts and what is at stake. CVI programs weren't around in 2009. And while I can't speak for everyone, I can say that many of us who have suffered this kind of loss wish we had resources like CVI years ago. Because we know that these programs work. They prevent violence before it happens, they reach people before it's too late, and they are making a difference right here in Austin, Texas, on our streets. Last year, CVI programs provided personalized support to over 280 high-risk individuals, prevented or de-escalated 52 potential shootings, and has allowed us to respond to over 15 shooting incidents to prevent further violence. And over the last 2 years alone, we have seen a 42% reduction in gun-related activities. This is impact, this is progress. At the city, we're prioritizing community violence intervention programs. For multiple budget cycles now, I have championed more funding and will continue to lead to ensure that it remains a priority for this city council. And although there is a lot of uncertainty and frankly a lot of confusion surrounding federal fund cuts, I'm proud to say at the city level we expect sustainable funding through fiscal year 2026. We're also working closely with our service providers to secure additional philanthropic dollars to keep this work moving forward. Let me be clear, funding CVI is not an option in Austin, Texas. It is a necessity. We have a responsibility to stand in the gap, step up, and find real solutions to these problems. This is why I'm especially grateful to look and stand along these folks today to see so many of the partners that are in this fight that are doing the work on the ground, which is where it is most needed, on the ground in the schools and in our hospitals. The only way we succeed is by working together. As the DA mentioned, you're hearing a premium being put on community and collaboration, and especially communication. Across jurisdictions, across agencies, and across communities, we will only rise and conquer this problem by working hand in hand. Let's keep pushing forward. Let's stay committed to addressing gun violence, saving lives, and building a stronger and safer Austin. As my friend Sean Oliver stated, we will continue working towards becoming a city that is proactive and not reactive to crime. And that is an issue that we will all follow. Thank you again for your leadership, advocacy, and your commitment to this work, everybody. I know my brother Pancho would be proud, not of just me standing here today, but to be able to stand in this room with you. Thank you.
Although Councilmember Velasquez has been a lead voice in this work, he has certainly not done this alone. And so I also want to thank Mayor Watson and the entire Austin City Council for their support of this work and for their support of our overall public safety efforts here in Travis County and the city of Austin. Thank you so much for being here today. I think likely some of us will be available for pull aside